connecting though. Okay, now it's working. It's telling that there's followers.
Okay.
Perfect.
Yeah, so there's one follower on Facebook right now.
Okay.
Just one though. But it says that we're telling the followers you'll start a live video on Instagram. So
All right. So
this means one, this means two. Okay, but so far.
we're just letting everybody know that we've got these giveaways tonight.
Yes.
Watch to the end. We're giving it away at the end.
That's right.
We'll keep reminding you.
We're gonna have 2 winners. I know we kind of already said this, so if you were already tuning in, but we were having some technical difficulties, but we're gonna have 2 winners, one on Instagram and one on Facebook. So just make sure that you interact, ask questions, and that's how we're gonna determine who wins. And we
Let
have
us
some
know.
Dysport, and we have this amazing lip kit that has a Dior lip gloss, an Elastin lip recovery balm, a lip mask, and
If somebody wants the stuffed lip pillow,
Yeah.
that's negotiable.
all right.
All right,
We should
so
get started.
yeah. We're gonna
All
get
right.
started. So what are we talking about tonight, Jamari?
We are talking about a lot of good stuff, but my favorites, lips and lasers. Those are probably 2 of my favorite things
They are.
to do. So, and then also Dysport, of course.
People are happy with those.
Yeah.
Your last patient had 3 lasers.
Mhm. Yeah.
What a difference. Wow.
This laser that we have is really amazing, and it yields such amazing results with such little downtime, which is the best part of it, because nobody wants to be down for 2 weeks, you
Yeah.
know? I mean, yeah, it gives you good results, but getting there is so torturous.
Well, it used to be torturous. And
Yeah.
Now it's not. That's
Now
the
it's
great
not,
thing.
not with this.
So, tell us about yourself, Jamari.
What do you want to know?
Tell us your background real quick and.
Yeah, well, I mean,
Get to
most
know
of you kind of know me, but I'm a nurse practitioner. I've been in medicine for over 12 years. I've been practicing aesthetics now for going on 3.5, close to 4 years, I think it's coming on. So, yeah, a lot of my nursing career, I did a lot of critical care, ICU background, so I have a lot of, quick thinking on my toes. But I've always loved aesthetics and, detail work. It's just, I'm very passionate about it. So this was like the perfect mold of both my passions, aesthetics and medicine. So I've been here with Dr. Bear for going on 8 months now, I think. Yeah. And yeah, I love it.
And our practice is very concierge, so it's not, when you come in, you're not gonna see a million people in the waiting room. Actually, we don't let anybody wait in
Yeah,
the
right
waiting room
now we're
still.
very good about it.
But you're not gonna see, it's not gonna be 20 million people running around and everybody just in and out, injecting that. We really look at you as a, whole face, whole body, and really kind of
Absolutely.
put everything together to give you a more, not just do your lips or do your nasolabial, or we're gonna put the whole package together for you.
Total face transformations. And truly, at the end of the day, that's when patients are the happiest, because yeah, you may come in complaining with one thing, but when you do pan facial rejuvenation, that's when you're really gonna get your best results, and really, those
Happy
are the
patients.
patients that walk out so thrilled with their results.
Yeah. So about myself real quick, for those of you that don't know me, I'm a board certified MD. I'm an internist by training, but I've been doing aesthetic medicine for 20 years now. I can't believe it. Practicing for 30. And I know I don't like a day over 20.
It's true.
It's just, I love it. It's changed so much since I first started, I'm learning still all the time because the field is changing every day. And I think it's important, even though I've had tons of experience, to stay up on everything.
Absolutely.
So I can't wait. I'm going to a big anatomy class actually in a week now, and it's going to be like an all-day anatomy injection class for 2 days, and
I know, I'm so
that's going to be. I was a winner of that class, so thank you, Swift Beauty. Thank you. Very excited to do that. So
Yeah.
today we're going to talk about lips and lasers, and just to remind you, there's a secret code at the end, and it's going to be 15% off everything we're talking about today. And we're having a raffle at the end, and basically it's based on your participation, and we've got these great items we just talked about. One area of Dysport and our little lip kit.
Yes.
That's like a $250 value. So stay with us and you'll get great things. So we're going to tell you everything you ever wanted to know about lips, and You know, I always like to call it lip rejuvenation, not lip fill,
Yeah,
you know, because
absolutely.
not everybody wants bigger lips, or, you know, the young girls tend to want more volume.
Yeah.
But some people, it's all
Some people
about,
don't.
yeah,
And I think that's a common fear for a lot of our more mature patients too. They don't want huge lips, but our lips lose volume as we age too, so we have to make sure that we don't neglect them as a whole, because if everything else looks nice and tight and lifted and put together, but the lips look like little raisins, you know, it shows, you know, that's signs of aging as well. So, like she said, rejuvenating the lips is just as important.
and I think, you know, when we talk about this, people come around to it, you know, I have
Yeah.
patients that have been with me for years and years, no, I'm not gonna do my lips, no, not my lips. You know, it changes, once I can kind of talk them into it per se, but it just changes everything. That's
Yeah.
the focal point of your
Yes.
face in a lot of ways. People are always looking at that. It's
Mhm.
right in the middle, it's bright red,
Mhm.
and, you know, it needs to be taken care
Yeah.
of, so.
It harmonizes, it balances, and that's I think one of the important things too when we talk about concierge medicine. When you come here, we really are paying attention to everything as a whole, because we want your face to be perfectly harmonious. We want everything to balance. No one feature should stand out alone. So, you know, your lips shouldn't stand out, your cheeks, everything should just be balanced and kind of in sync.
Right, and you know, we care about what you're seeing, you know, what bothers
course.
you. Normally, yes, we wanna fix that, but a lot of times we have to fix other things to make that
Better.
exactly be
Yes.
in harmony and balance. So these are some different lip shapes, and, you know, everybody, I think when they think about filler, they think about the one up there, the big puffy
Yeah.
lips, but,
Mhm.
you know, we always have a conversation with you. What do you want
What
your
are
lips
your
to look
goals?
like? Show
Yeah.
me a picture. What bugs you about your lips? A lot of times it's thin, they're asymmetric,
Mhm.
and even the young patients, they're afraid.
Yeah.
They're like, oh my God, I just don't wanna look like that. And the reason everybody's so focused on that is because those are the lips that are done in not the greatest manner. And
Or overdone,
they-
people get a little
right, and
addicted.
then that's what you're gonna notice.
Mhm.
I always say there's millions of really nicely done lips around that you don't
even
notice
know.
because they're nicely done.
Yeah,
So, you know, we'll look at your lip shape, what you've got to deal with, and,
absolutely.
you know, we always like to have that conversation.
Also, you know, I think it's important to point out too, you know, there's all different types of lips out there. Just, you can bring a picture to us and tell us like, okay, these are like the goals that, you know, I'd like, but it's very hard for us to completely change the shape and, you know, the complete look. We can enhance things and, you know, tweak a little bit, but, you know, if you have like longer lips, it's very hard to like you know, we can't change your anatomy the way you were born. We can enhance them and make them look prettier, but changing, you know, and you don't want that either, because then it's not gonna be you anymore. We just wanna enhance what you were born with.
I think a lot of younger girls,
Yes.
because Instagram is so
Yes,
heavy on,
deceiving.
you know, yes, deceiving,
Filters.
it's, you know, and sometimes these lip changes, they were done over 2 years' time.
Mhm.
You can change things with patience and persistence, but you can't, you know, you can't completely change.
Yeah.
So if somebody has a scar, or they have, you know, are born with something asymmetric, you know, we do our best. We can't promise it's gonna
Of course.
be
Yeah.
perfect. But, and I agree, you don't want to look different, but it just depends on the age, you know, it's like
Yeah.
prejuvenation, rejuvenation. A lot of girls in their 20s wanna look different, and there's
Mhm.
nothing wrong with it. If somebody had super thin lips, or they smile and their lip goes away,
Yeah,
That's-
absolutely.
that's
Those are things
something
we
we
can
need to-
definitely
yeah.
improve, for sure.
so. We've got many different products to choose from, and I just, all I want you to say to you is just let us help you choose. Don't come in
Yeah.
and say, "Oh, my friend had this product and I want that product." You know, like she said, every lip's different, different shapes, different, you know, the skin might be thin.
Right.
And just let us help you. We have very thin products, and we have very voluminous
Yeah.
products. So, you know, if you're scared, starting off with a thin product is great.
Yeah.
I think you can't go wrong. You'll get definition, you'll get your lip lines taken
Hydration,
care of.
yeah.
Hydration, corners up, you know, so I think
Absolutely.
starting in the beginning, this is just a little bit about lip fillers. They're all hyaluronic acid fillers.
Yeah.
and they bring water in, some of them more than others. Like I said, some are thick, some are thin.
Mm-hmm.
So just don't worry about it. You guys
Well,
have
I
enough
think
to worry
that's
about
the
it.
important part of making sure that you trust your provider and your injector, and going to somebody who is, skillful, has a lot of years of experience, because that's our job. That's our training, is to figure out what's going to work best for you, and trusting us in the process. We want you to be just as happy. So, making sure that we're choosing the right products for you, that's, is part of our
Right.
task.
I think
And
that's
the consultation process.
hardest part of our job.
Yeah.
Is to manage expectations and achieve those expectations, and I think for the most part we do, so obviously
Absolutely.
that's why we're still around. But you're speaking for pain, people always ask, is it gonna hurt? Well, anytime we're putting a needle in your face, yes, it's gonna hurt.
Yes.
But we do different things to help it hurt less, mini dental blocks,
Ice, numbing cream.
and the big daddy that I forgot
Pronox.
to tell a patient about today, and she was not happy. Pronox, the laughing
Yes.
gas, that's a game changer. So
Yeah.
when all else fails, it's just gonna put you in la la land, and within 10 minutes it's gone. You can drive home.
Yeah.
That's been really great. And just you take a few puffs, we inject. Take a few puffs, we inject.
Yep.
It's great. And then sometimes I have to give like anti-anxiety medication, because to me a lot of times pain is anxiety.
Yeah. That happens too, even like, I'm sure we're gonna talk about it, but with our laser, so many of my newbies, they're so anxious before they start, because they don't know what to expect, or they're just so afraid of how it's gonna feel. And then once they actually get the treatment done, they're like, I don't know why I was freaking out so much. Like, it was not even that bad. It was like fine. And then every treatment after that is like, again, no big deal.
Right.
But that first one, it's that anxiety, that like, anticipation until you get to it.
Yeah, I think that having that good experience is always important.
Mhm.
It's and I've throughout the years seen a lot of patients that come in, no, I don't ever want my lips done. I had it done once.
Mhm.
They didn't use numbing cream. They didn't know me, and oh my God, I'll never do. And then I always say, we can get you through. Once we can get you through,
Yes.
and you have a good experience, then you're fine. So let's talk about that lip filler journey, because
Yes.
we see it all day long. We tell patients about it, and
I love this
until
chart.
they experience it, they don't
Yeah.
realize. But
Absolutely.
go ahead and talk about our lip journey.
Well, I would say most of the time they come in, lips are too small, they want something done, so we fill them. First, maybe day 2, 3, it varies per patient, but around there, people are freaking out, they're so swollen, probably, some bruising too.
Do you
And
ever
they're
have them in
usually,
the office? They look in the mirror like,
oh my gosh,
my
yes.
husband's gonna kill me.
Yes.
No, he's not.
I'm always like, no, I promise they're gonna go down. And then by day like 3, 4, again, bruising, the lumpy bumpiness is super common. You're kind of like touching everything with your tongue and like feeling all these ridges and lumps. By day 5, you're like, okay, now I like how this is looking. Getting new lipstick, getting that lip liner out and really just like making them pop.
Yeah.
And then by the 2
Clean 'em out.
weeks, they're like, crap. I kind of liked them when they were swollen. I need
This-
more filler.
And this is where they come see us.
Yep.
And they go, yeah, I
You
like
were
it,
right.
but I really liked it when it was swollen. Maybe next time we can do a bigger filler.
Yep.
And it's universal. And they always say, I know you told me I'd say that. So
Yep.
it's the lip journey.
It's just part of the journey. Yep.
We always say like at 2 weeks is usually when you love your lips.
Yeah.
That's when you're in love with them.
Yep.
And want more.
Absolutely.
You're officially an addict. Even if you're, like my older patients that I'm doing a very thin product, it's like they love them.
Yeah.
2 weeks.
I think I love seeing when patients get so happy that they can put lipstick on again on their actual lips and not on their upper lip.
Right,
you
and
know,
not outlining.
and creating like their own lip because they've just lost so much volume that they have no lip anymore. So.
And this is just showing a bit. You can see how calm she is. She's got the needle into her mouth, into her lip, and we've got our little vibrator, and she's calm and happy. This is kind of before and after. This is just a little rehydration. It's very natural.
Yeah.
Just kind of showing you, what can be done. And then we have a few pictures. Some young patients that wanted lip volume
Mhm.
and, a little more lip volume.
So
Really pretty, pretty lips. And a lot of these these are right after, so they're gonna be swollen.
Yeah.
This is going from no lips to what they wanted, very full lips. And
This was over several seatings too. I believe this patient, right?
actually, I think that was one or two maybe, but yeah. Another, trying to help her asymmetry and kind of hydrate beautiful bottom. Like if you have a beautiful bottom lip, we'll not touch it, you know.
Yeah.
Another patient, just, you know, these are just different types of lips and different types of lip fill.
Yeah.
This is a patient that still likes to
Overline.
overline a little bit, but really pop in. And this is a very common lip rejuvenation where we've got what we call the barcodes, the little lines, and sometimes, you know, prejuvenation. Patients that come in and they're seeing those lines start,
Yeah.
we like to put a little bit of Dysport or,
Yep.
you know, a neuromodulator in there to stop that puckering. But then if you're gonna do a lip rejuvenation, we can actually look at those and fill them to, you know, prevent that from ever happening so
Yeah.
that you won't ever have deep lines.
Yeah.
So now we're gonna talk about the cool laser. Anybody have questions about the lip filler, lip rejuvenation, the lip journey? I think, you know, there's a lot of information out there, so,
Yeah.
you know, ask us things. Go ahead.
Yeah, a couple other people said they don't want any like duck lips, and they also ask how long do these lip fillers last?
Good question. So, duck lips. I always say I don't do animals. We don't do animals here. No ducks. No monkeys. No chipmunks. We don't like. We love animals, but not on your face. So, we don't do animals here. And then how long do they last? I usually tell my patients 8 to 12 months. Now, you know, some people like to come every 6 months to keep them fresh. Maybe,
Yeah.
you know, you can do a half a syringe if you want, like every 6 months to keep it fresh, or you can wait and, you know, but most of my patients are going 8 to 12 months without a problem.
Yeah, I agree with that. I think, you know, we know that for the most part it lasts about that 8 to 12 months, but I think at least like a lot of my younger patients, they don't like to wait that long because they don't
Right.
want them to completely, you know, deflate. They want to stay
Yeah.
plump and luscious. So, you know, they stay about the 6-month mark
Right,
for
right.
for my patients. But
Yeah, I think 6 months is nice if you're, you know, if they can and they wanna come in and just give a little refresh and,
Yeah,
you know.
absolutely.
Or if somebody's trying to go from a very thin lip,
yes.
then usually at a month or two, we can just build on that and keep building on that.
Yeah, I think that's a really important thing to take note, because we do have patients sometimes that come in, they have barely a lip, you know, it disappears when they smile. And it's very difficult to go from that to, you know, big ginormous lips. You can't, you know, for various reasons. It's not safe, you know, you can compromise the integrity of the vasculature in the area. So it's important that we move in stages in those kind of scenarios,
Yeah.
which is, you know, like Dr. Barrett said, you know, every month or two you can come in and we can throw in another syringe, and once that tissue is kind of stretched out a bit. So,
Yeah, patience and persistence, I think.
yeah, absolutely.
So our cool laser,
Yeah.
I'm gonna let you talk about prejuvenation with it, because I think it's really neat to have you being younger,
Mhm.
me being a little bit
Younger.
younger than you, a little. But, you know, it's two different perspectives, and
Yeah.
our patients come in, it's not like all the young people see her and all the older patients see me, but, you
Yeah, we
know,
have a good mix.
it's a nice mix, we both see them, but there's some patients that they need prejuvenation and some need
Mhm.
rejuvenation, so you can
Well, I
talk about our
think,
prejuvenation.
I think with you know, I always tell all my patients it's much easier to prevent than to correct. It takes a lot more work when you're trying to reverse, you know, the signs of aging. It takes more work, more product, more persistence.
Yeah.
If you start by a younger age, and that's why people are like, oh, why do you do Botox? You don't need Botox. No, I do it because I don't look like I need
Why
it,
we
because
don't
I
need
do
Botox?
it.
We don't look like
Exactly.
we need Botox because we do it.
Exactly. You want to stay ahead of the curve. So if you do small little tweaks and treatments here and there, you know, at a younger age, you're gonna age more gracefully, and it's gonna, you know, it's gonna look a lot like very natural, very soft. You know, like now I'm in my mid-30s, and I always say, like, I've noticed, especially this past year, just a lot of signs of aging, and we know that collagen stimulation or production dramatically drops in
Right
your
at
30s.
30. Yeah, we're
Yeah,
recording.
and I'm seeing it 100%. So that's why, like now, yes, I've been doing my neurotoxin for probably about 5 years now, and I'm starting to do like lasers and things like that, and that's just to help tighten the skin, stimulate that collagen, and just
Yeah.
try and stay ahead of the curve.
Yeah, I think it's so important. People ask me, do I need a laser? Yes.
Yeah.
Yes, you all need a laser. Everybody.
I've even had patients as young as like 22 coming in to do
no.
lasers, and you
They
think
should.
like there's no reason. Well, that's not true. This laser in particular treats acne scars, any kind of scars, pores. So I mean, yeah.
No, that's
Why not?
great. Yes, question.
Yeah, so viewer says, I'm 21 years old and I love my neuromodulators.
Yeah,
Awesome.
that's right. Exactly. You're staying at baby Botox, staying ahead of the curve, softening everything up.
You're not gonna get
Avoiding
the
those wrinkles.
doses, like so on a more mature patient, we might be doing 60 doses, 60 units, and
Yep.
on a young 20-year-old, we might do like 12 or something, or 20. It's like, I mean, it's tiny doses go a long way in a younger
Sprinkle it
patient.
everywhere. Yeah.
Like just put little doses in there, and it's preventative, and it's
Absolutely.
refreshing looking,
And we have to remember too, everybody ages differently. Not every 22-year-old is going to look the same. I mean, we've seen some 22-year-olds that probably look like they're in their mid to late 30s. It just depends on genetics, if they're outside baking in the sun, all these factors really play a part. So that's why, if you're curious or you're not sure, just make a consultation and come on in.
Yeah.
We love to chat with patients and just discuss all your options.
I think the other thing that sets us apart, we're very honest about things. So
Yeah.
the fact that you walked in the door doesn't mean you're gonna walk out with, deer in the headlights, discord, or, everything in the world that you didn't need. We're always gonna give you just the things you need. We don't oversell
Yeah.
things. We're very honest. When you're 20, we wanna be appreciative. I mean,
Absolutely.
we were just talking before this started that some of the 20-year-olds that are going and trying to change things, sometimes I feel like some of them on Instagram that I see, they look now like they're 40, they look too mature. So we have to, I think it's a balance.
Absolutely.
But I mean, we'll listen to what you want, but we also, at the end of the day,
Make the recommendation
Yeah.
that we feel is, can be good.
so rejuvenation, here we go. This is my patient who's addicted to laser, and her results were incredible. And yes, she still has some lines around her mouth, but the unfortunate part with her is nothing else worked for her. We've tried Radius and Sculptra fillers, she just kinda eats through everything. And this laser has been, as you can see, phenomenal for her. The tightening, the sun damage, pigment pores, and it was fabulous. So she's so happy. She actually comes in, has one done every 3 to 6 months, just to kind of, the results will last 2 to 3 years, but she's going to stay on top of it. And this is our laser here. We kind of brought it in for a visual for you. It's really very easy. It's a fractional CO2 laser, which is the gold standard. So there's a lot of different things out there. There's Erbium, there's YAG, there's IPL, there's a whole bunch of different options out there. But I've found, I've been using this laser for at least 15 years. And it's the 4th generation of the Deca Dot, and this one has been a game changer. Because like we talked about, with fractional CO2 laser, used to be like 7 to 10 days of downtime, single treatment, people oozing, waking up looking swollen and like a monster.
Like a burn victim.
And, at the end they would love their results, but it's just how many people in this day and age have that time. So this laser, when it came out with less downtime, no pain, it's a busy machine for us.
Absolutely.
Very happy patients, very excellent results, and
Absolutely.
I can't say more. And that's why I say, anybody, this laser is for everybody and anybody. And if you can do one, do one, because you will definitely see a difference. But we usually recommend for the cool laser 3 treatments. 1 month apart.
That's
And-
our ideal.
And if you want the one time where you want to have the downtime, even with that treatment, this machine is doing it better. And we have things that we can add, like the plasma. The plasma is amazing.
PRP. Anytime you add PRP, which is your own platelet-rich plasma. It just speeds up your healing so much more, and it I feel like it just makes your results that much better too.
For
So,
sure.
we always encourage, definitely, if you can add the PRP to your treatment, it's a good idea. It's gonna make your recovery that much more seamless and your results that much better too, so.
Yeah, and the other thing that we encourage is to get a neuromodulator like Dysport or
Oh, yeah.
Botox or Xeomin. Get it on board because, if you've got lines, even if they're faint lines, and you're still moving those muscles,
You're just gonna create,
yeah,
continue to
it's
create,
not gonna
yeah.
heal as well.
I had one patient, she was kind of very against it for a while. We did the 3 lasers, she had amazing results, but she just had that deep, 11 line here. And I finally got him let me just at least treat your glabella. And then we, if you don't like it, you don't ever have to do it again, but you can go from there. And so she agreed, and she could not even believe, even her daughters were like, wow, Mom, your eyes look so much better and awake. And she didn't even realize, even at rest, she
Yeah.
always had her glabellar complex engaged. It was just constantly engaged. So
Yeah, I think a lot of people do that. Chins is the other
Mhm.
big one that I've been on chins for a long time. It's just people talking to me and I just see their chins scrunching up and that's gonna lead to lines and
Yeah.
wrinkles. So before you do your laser, we beg of you to just do a neuromodulator, do some Dysport, Botox or Xeomin, and relax those muscles, then you'll have a
Absolutely.
great result. I always say, even if you just do it this one time and you don't ever do it again, which they always do it again
Yeah.
because they get addicted, but it makes a huge
It does.
difference. So
yeah.
I'm just show you, it's crazy her
Yeah,
results,
I mean, you can just see her pigment even, and her jowls,
The
look how
tightening
much
is
tightening she got.
crazy. And this all with just a laser,
Mhm.
just a machine. This is one of our young patients. Under her eyes, I want you to see, she's got
Yeah.
some nice tightening. And then I don't know if you can appreciate from, in online virtual world, but her pores are so much
Yeah.
better, so much smoother. So this is a prejuvenation.
Mhm.
She's very young, she just has pores and starting to get just a little genetic laxity under her eye. What an easy procedure to do to
Yeah.
say, hey, let's refresh you.
Yeah.
This is a patient who's 5 months after her 3rd laser. Look at it, she looks like a different
Yeah,
woman.
her eyes are
She's it's tight. In the one picture she looks sad and
Yep.
she's really lost at least 10 years. Another patient, this is a combination of some fill with the laser, but just she's always struggled with lines around her mouth. Another patient gets tightening, and it's just amazing. I want to almost
Yeah.
say lifting with the laser, which leads me to our new protocol for alt therapy. And those of you who've been on here before probably heard about alt therapy. Alt therapy is more of the lifting. It's the focused ultrasound.
Mhm.
And I've recently changed our protocol for it, and I think it's been working so well. What we're doing is the deep part of the alt therapy, and then we do this laser right on top of it, and it's just,
Yeah, the results have been
astounding.
great.
so you're gonna get lifting, you're gonna get tightening, you're gonna get pigment reduction, pore reduction, everything, wrinkle reduction,
Yeah.
it's all gonna
absolutely.
be fabulous. And then with our laser, it can be done on any body part. Hands are great, obviously neck and décolleté, we wanna hit those
Absolutely.
areas.
I think that's important to highlight too, because a lot of times we just focus so much on our face, and then our face looks amazing, but our neck, is really showing signs of
Yeah, it doesn't
aging,
match.
so it doesn't match up. So we always encourage, definitely don't neglect the neck, treat
Or
it
some
too, so
here.
it catches up or it stays on par with, what's going on up here.
Yeah, it's gotta all match, and we
That's
see
right.
that a lot.
We see it a lot.
It's just the face, and I think I'm guilty too. I do my sunscreen on my face, and I'm not as good on my neck and
Mhm.
chest, and it shows. Thank God we have the laser. So get your hands in here and
That's
do
right.
that. Dysport, we've been talking about it already. It's our neuromodulator, and the neat thing about Dysport is it has a little more spread. So areas especially like your forehead, your crow's feet, it kind of spreads so it's a little more even. It's wonderful. We have all these different areas to put it. It's not immediate. It's gonna take 3 to 10 days to kick in,
Mm-hmm.
and very
But it's
safe.
really nice.
Yeah, and prejuvenation, like we talked about, baby Dysport.
That's right.
And it is addictive, I have to say. I'm always honest about that. This kind of talk about the
so many
different
of the
places.
different places we can use it.
What do you think is the place that you think patients are most surprised about?
I would say the lips.
Yeah, the lip
It's so, the lip flip. I mean, I know I've posted it before on, Instagram and stuff, and people are like, absolutely not. How could you ever even think about putting it? It's like, no, actually, it's a thing.
Actually, when I first started getting a lot of young girls, their moms would bring in and they're like, my daughter thinks she wants her lips, and I know you're gonna tell her the right thing. And I would always start with the lip flip just because it's palatable to the mom, and then they kind of can see. So the way it works is we just put a little bit at the border, and it relaxes the muscle so that the lip kind of
rolls out a little
rolls
bit,
up, and you see more of the red. And you can do it on the bottom lip too. It's very beautiful.
Yeah.
And it
very
doesn't
soft.
last as long as a lip filler, but it's sometimes a good first start for somebody, especially
Good way to
who's
dip your toe in the
afraid.
water. Yeah.
Exactly. And then if you want something more lasting, more volume, then filler's the way to go. Gummy Smile, I think, is something I think I forget about it a lot. It's a really neat way. If you smile and your gums show, we can just relax these muscles here, and they won't pull your lip up as much when you smile. And it's really a game changer.
Yeah.
Because it's nice to show your teeth, but sometimes if you're showing your gum,
too much.
it's too hard of a smile. And I think that's one that I probably forget about sometimes.
Yeah.
Masseter muscles through COVID have been a big one. We can relax the muscle here for, that it's involved with TMJ, and people will sometimes get very bulky here, so aesthetically it'll look better.
Yeah.
But people who are getting headaches and, finding that they're getting tightness, grinding. I've had dentists who referred patients for that. It's a game changer, and it's really will last you 6 to 12 months. Usually we use 30 units between both, muscles.
It's a big muscle, so it's gonna take a little bit more units, but it really makes a huge difference. I mean, she says it all the time, a lot of times just by injecting, like a lot of patients find relief. It's almost like an acupuncture, like effect.
They're like, oh.
Yeah.
Yeah, it's horrible. I mean, people struggle with, and I found COVID has really brought it out a lot in people.
Absolutely, for a lot more stress.
Cystic acne is another neat one, because, I can do, if somebody's got a big cystic pimple, we just pop a little drop in there, and I always tell them within 24 to 48 hours that acne is gone. If somebody has a lot of cystic acne, we can do a treatment called microtox, where we kind of just deliver it into the dermis everywhere in the skin, and it really helps. So
it gives a nice glow, tighten the pores. It's really nice.
Neck bands, a lot of patients didn't know we can do neck bands, so if you see these bands in here, I know we do, that's why I'm showing them.
So after this, we're gonna go treat Dr. Barrett's face.
Go with your teeth like that, and if you see these bands, we can put a little bit of Dysport in there, and they'll just lay right down. It'll be nice. That's what we're gonna do tomorrow. Bunny line's another one here.
Absolutely.
Chins are my favorite.
There's so many versatile uses for Dysport, so.
Yeah. So on to specials.
Yay.
So our secret code is Lippies.
Lippies.
So if you call the office or DM or text us or email us and you say, I want to get Restylane or RENU Cool Laser or Dysport, and call me, and the secret code is
Lippies.
Lippies. So if you do that, you're going to get 15% off these, and it's, I think people appreciate that.
Absolutely.
So, and you want them.
It's almost Valentine's Day, so you gotta get those lips all luscious and plump so that you can share some smooches.
With your dog or wherever. It doesn't matter. Your kids.
Or your wine glass, it's fine.
So I do want to tell you about our fashion night. It's going to be fabulous. My friend Ingrid Jolie is producing it, and it is the real deal. It's not like a homespun fashion show. It's going to be wonderful. We have at least 4 designers coming. Really beautiful clothes. Some will be a little fancy, some will be everyday. really cute things
Yeah.
and live real models. It'll be right here in our wonderful theater and our office. So the theater seats are VIP. In the office, all our RENU clients will be getting in free. And if you want to bring a guest, it'll be a $50 charge, but all the money is going to Little Smiles. And they are a great organization.
Yeah.
They're here in
local.
Jupiter. They go everywhere from Fort Pierce down to Miami. And what they do is they help kids in the hospital, mostly underserved or underprivileged kids. They get them pajamas or a laptop if they're going to be doing virtual school from there. If they just need pizza or snacks.
They help family with foods and dinners if they need to.
And they help shelters too.
Yeah.
And
I think it's just nice, like, that it's a local organization, so you really know where your donations are going. Sometimes, you donate to these, bigger companies, and not that it's a bad thing, but you don't ever really get to see or know exactly where it's going, so.
I personally choose 3 charities, and
Yeah.
all of them I know the money goes to the kids, and it's gonna be well used, so. You have to RSVP though. And if you know of anybody who's interested in sponsoring the event, we're still looking for some sponsors, so there is limited, we only can have a certain number of people here, so please make sure you RSVP and let us know how many people are coming. But it's gonna be fun, food, wine, DJ, we usually end up dancing, and it's a great event.
It'll be a good time.
One other thing, we do have a giveaway at the end of the month. We are giving away a full face laser. So it's a free laser, $850 value. And that is on Instagram. We have a post. It's a post of before and after laser. I think it was probably done like 6-7 days ago. Just, you go to the post, follow the directions, and at the end of the month, we'll be announcing that. So that's pretty exciting. We have never done a big giveaway like this, so it's really,
I'm
really
excited.
cool. But tonight, we're gonna announce our raffle winners for tonight.
Yes, so let's start with the Facebook. So Facebook is gonna be, which one, Dr. Barrett?
The Facebook, should we do the lip, let's do the lip bag, the lip kit.
Okay.
The
So our Facebook winner is gonna be Michelle Kratzer.
Michelle.
So congratulations,
Woo!
Michelle.
Hey, Michelle.
You won this lovely little lip kit.
So just let us know, Michelle. You can message us or call us tomorrow, and we'll figure out how to get your lip kit. Hopefully, you can stop by either office to get it, or we can mail it to you. But hopefully, you're nearby.
Yeah.
And
then our Instagram, who's gonna win one area to sport, is Sam Monroe.
Awesome.
So congratulations.
Yay, Sam. I was not a cheer. You were a cheerleader. Come on,
Well,
cheer.
a long time ago. I'll pull something now. I'm not as limber as I used to be.
So we want to thank you guys for watching, and
thank you guys for tuning in.
This.
We do. We have so much fun, and we
It's
love
too
giving
much
back to you
fun.
guys too. And thank you
you
guys for your participation.
Have any other questions, or like I said, free consultations? We're here.
Yeah.
We love to just chat with you about your needs and
Absolutely.
desires.
And we always post our video on our feed after, so you can always comment on there, and we're pretty good about responding back. So if you
Yeah.
have anything, a small question that maybe you forgot to ask during our, webinar, you can ask it down there, and we'll get back to you.
And it will be posted for, if you know anybody who doesn't, obviously all of you do Instagram and Facebook, or you wouldn't be seeing us. But it will be posted tomorrow on YouTube for those who don't go on there. And then it will be on for 24 hours, so you have 24 hours to watch it over and over and over again. All right, everybody,
guys.
happy Valentine's Day.
Have a good one.
Love yourself. That's the best love out there.
It's true.
That's it.
All right, take
Bye.
care, everybody. Bye.